So in fact, artificial intelligence is quite accurate these days based on the imaging modality. For example, when we use high quality images to extract features such as MRI images, the artificial intelligence model can be very accurate, and the sensitivity is quite high. Of course, it is related also to the outcome that we want to extract. For example, if we just want to identify if it is, for example, the recognition of a malignancy, it can be quite accurate. If we want to identify or to extract a little bit more complicated data, like, for example, a prognostic model, or, for example, the prediction of a Gleason score, then the accuracy is a little bit less than the previous ones. In fact, it's already been used in practice, and that's the good point for that. Actually, artificial intelligence models have been implemented for quite a few years now. First in experimental, now in some clinical settings. It is something that artificial intelligence does using the techniques of machine learning, and especially deep learning. They can extract features from images that are not otherwise seen by the naked eye, and give us results that we cannot, let's say, find or retrieve by our own. In fact, artificial intelligence can also combine not only the extracted features from the images, but also combine clinical data and give us more accurate results. At the moment, artificial intelligence models are being used and assessed in every urological cancer, especially in the prostate cancer, in kidney cancer, and bladder cancer, which are the most common. However, there are studies and models that assess testicular cancer as well. In other more rare types of urological cancers, such as penile cancer or urethral cancer, we don't have currently at the moment an artificial intelligence model. However, in the prostate cancers, the level of evidence that we have is quite high, because there are more than 40 systematic reviews now available in the literature, which means that researchers are doing great work on that and dense work to publish the results at this high level of a systematic review. This is a great question, and this is what European Association of Urology is currently working. In fact, using artificial intelligence, we can have some prediction models, and based on these prediction models, we can interfere in the treatment of the patient. However, using big data on these artificial intelligence models, we can have outcomes and personalize evidence that could apply to specific patients or to specific group of patients. And this is how we aim to modify treatment in the next few years. Apart from artificial intelligence and the analysis of big data for prostate cancer and other urological conditions, I'm also involved in the guidelines office, especially I'm a member of the MELATS panel of the European Association of Urology, and my main interest is functional urology.
Mm-hmm. Okay, thank you.
It works?
Okay, that's works.
Good.
Okay, thank you so much.